Is it? Let me see. Do you know the causes of acne? The first causes is because
one of the major reasons causing acne is oily skin. For instance, when final examination approaches and you need to study hard, you tend to take less care of yourself and you may fall asleep while studying. Little did you know that this action can cause your face to come into contact with possible grease from your desk or your coat, resulting in a clogged hair follicles. When your pores become blocked, the bacteria Propionibacterium acnes living on the skin can trigger pimple infection, therefore causing redness and swelling. Another reason causing acne is talking on your phone. Nowadays, you carry your phone everywhere and it seems that your phone screen is a possible site of bacteria accumulated from your fingers. When you're on a call, these bacteria may cause breakouts around chins, cheeks, and mouth. Therefore, it is advisable to use an antibacterial wipe to clean your phone. Furthermore, not cleaning your face at all will result in impurities, dead skin cells, and excess oil on your skin's surface. Continuing this habit may lead to buildup of oil and dirt and may eventually worsen your face over time.
When you sleep late, you will notice that your skin actually secretes more sebum. And this probably explains why it results in new acne. A lack of sleep will promote stress, and there are theories that stress can make pimples more frequent and much larger. For a while, these theories didn't have a whole lot of science backing them, but that's changed in recent years. Recent research from Stanford University found clear link between acne breakouts in college students and periods in which they had to take exams, during which they reported dealing with higher level of stress. Scientists hypothesized that higher stress levels stimulated the adrenal gland. When stressed, the body responds by pumping out hormones, and the overproduction of androgens, also known as male hormones, can stimulate the oil gland. When these glands produce too much oil, this excess substance can combine with dead skin cell, debris, and P. acnes bacteria, clogging up the pore and resulting in an acne blemish.
Eating habit can be one of the causes of acne, especially eating greasy food and sweet. Greasy food likely does play a role in acne, because acne is largely caused by hormonal imbalance and bacterial imbalance, so greasy foods cause acne by way of harming gut health. Moreover, working in a greasy area such as a kitchen with fry wraps will be the motivation of occurring acne, because the oil can stick to the skin and block the hair follicles. This further irritates the skin or promotes acne. And for another one, sweet is mostly made from sugar and white flour, which will be repeatedly broken down by our body, converted to glucose, and then flushed the bloodstream. When this occurs, our body reacts by producing insulin to counter the glucose insulin level spike, leading to inflammation producing enzyme, which attack to your body collagen through an oxidative process known as glycation. And this glycation will aggravate particular skin conditions, which is acne. Apart from greasy food and sweet, there are other eating habits that can be the cause of acne, such as eating food that refine grains and sugar, dairy products, fast food, or food that you're sensitive to. Some of those may be not directly cause acne, but if you want your face to be clear without acne, avoiding all of these can be much more helpful.
Apart from stress, eating habits, and dirtiness, there are several causes of acne, such as hormones, genetics, and alcohol. Firstly, common acne is generally caused by hormonal changes in the body, and its onset usually can be found in teenage years when puberty rears its head. Acne is directly attributed to the rise of androgen hormone levels. The production of these hormones rise when a child begins puberty and is the reason much acne is prevalent in adolescents. Secondly, acne is at least in part due to hereditary factors. Those whose parents have a history of acne are likely to struggle with the same condition. Last but not least, another vice that can lead to worsened acne is alcohol. Making matters worse, many people drink due to stress, which also affects acne-inducing hormones. Alcohol impairs the liver's ability to purify toxins, and if the liver is compromised, toxins are expelled through different channels, such as your skin. If you pass out after a night of drinking without washing your face, your pores are more likely to become clogged and create pimples.
Type of acne. First, non-inflammatory acne includes blackheads and whiteheads. Blackheads or open comedones occur when a pore is clogged by a combination of sebum and dead skin cells. The top of the pore stays open despite the rest of it being clogged. This results in the characteristic black color seen on the surface. Whiteheads or closed comedones can also form when a pore gets clogged by sebum and dead skin cells. But unlike with blackheads, the top of the pore closes up. It looks like a small bump protruding from the skin. Second, inflammatory acne includes purples, pustules, nodules, and cysts. Pustules can also form when the walls around your pores break down. Unlike pimples, pustules are filled with pus. These bumps come out from the skin and are usually red in color. They often have yellow or white hairs on top. Nodules occur when clogged swollen pores endure further irritation and grow larger. Unlike pustules and pimples, nodules are deeper underneath the skin. Because nodules are so deep within the skin, you cannot typically treat them at home. Prescription medication is necessary to help clear this up. Your doctor or dermatologist will likely to prescribe oral medication. This is made from a form of vitamin A and is taken daily for 4 to 6 months. It can treat to prevent a nodule by decreasing organ size with the pore. Cysts can develop when pores are clogged by a combination of bacteria, sebum, and dead skin cells. The clog occurs deep within the skin and are further below the surface than nodules. These dark red or white bumps are often painful to the touch. Cysts are the largest form of acne, and their formation usually results from a severe infection. This type of acne is also the most likely to scare. The prescription medication Zotreat is commonly used to treat cysts. In severe cases, your dermatologist may surgically remove a cyst.
There are generally two ways for acne treatments, non-prescription and prescription. For non-prescription treatment, you shouldn't wash your face neither too often nor scarcely. In fact, you should do it 2 times a day and gently wipe your face off with a separate towel. Also, you should not ever scrub your face as it could lead to irritated skin and more severe acne. For prescription treatment, you can use antibiotics topically or take them orally as they help remove bacteria. Topical antibiotics are used for externally treating less severe acne and cause less side effects, while systemic antibiotics cause more side effects and are used for internally treating more severe acne as they directly reduce sebum that can cause them. Apart from that, oral contraceptives or birth control pills can also reduce acne. If you take birth control pills containing enough estrogen and progesterone, your body produces them less, leading to less sebum and less severe acne. Nevertheless, you might struggle with some possible side effects, including weight gain, nausea, breast tenderness, or even blood clots.
There are also other treatments that can be easily done in our everyday lives. A change of habits can potentially reduce acne. One example is changing our diets so that we consume less dairy products. The consumption of dairy products stimulates oil glands, which may lead to clogged pores. We should also consume food that is rich in calcium, such as broccoli, almond, and white beans. When our body receives the right nutrients, our skin will become healthy as well. Drinking lots of water is also important, as water flushes out toxins and waste products in our body. Additionally, acne can be reduced if we get enough sleep. A lack of sleep promotes stress, which increases the production of the substance called cortisol in our body. This causes our skin to secrete more sebum, thus causing more acne. Lastly, our skin will produce less acne if we avoid touching our face. The continuous picking, squeezing, or popping of pimples is what irritates the skin and causes scarrings or skin infections. Our hands can be dirty, therefore if we do not touch our face often, we will be able to prevent germs or anything that is not clean from accumulating on our skin.